they're disinfecting. I didn't see any of this in the United States. Did you guys see this in the United States? I didn't see that in the United States. This next part's really important. Did you see any drones in the United States disinfecting? I haven't seen any drones in the United States disinfecting. I haven't seen residential neighborhoods disinfecting. I haven't at all. The Chinese took this seriously from day one. The Chinese took this seriously from day one. We did not at all. Hey guys, it's Dr. Murphy with Murphy Medical Associates. You're watching Murphy's Medical Minute. Thank you so much for tuning in today. Today is April 7th, 2021. I wanted to present all of this to you and take a really good time going through everything. Unfortunately, I got held up. I had patient care. Patient care always comes first. But today, April 7th, 2021, we are going to talk about a simple and plain fact that we all should be admitting to ourselves right now. Unfortunately, the political will is just not there. That's right. Today, on Murphy's Medical Minute, COVID's airborne, baby. You better get used to it. All right, guys, let's see where we're gonna start, and we'll get this thing underway. Welcome to the Muppet Show tonight. Just kidding. This is Dr. Murphy Medical Associates. You're watching Murphy's Medical Minute. Today, April 7th, 2021, COVID is airborne. Who is this live stream for? It's for everyone. It's for everyone who breathes air. That's right, everyone who breathes air. Cats, dogs, living together, madness in the streets. It is for all of us. So today I'm going to go through a couple of things that I want to dispel. The first is the little lie, right? This is the little lie where we believe that 6 feet is safe. This magical line is where we are in a bubble and we cannot be infected with novel coronavirus. We are wrong. We're wrong. So we'll review how we got that data today. In addition, we're going to review the timeline of data leading us up to today, April 7th, where the gold standard of building health chimes in and says that COVID is airborne. Once we admit that to ourselves, we now need to look for what should we do next? How are we going to protect each other? And what are our strategies going to be for the open up? And lastly, a quick little update on Canada. But first, how did we get to the magic 3 feet? No 6 feet. No 15 feet. No, I want a cheeseburger. No, I want a hamburger. Well, I'm here to tell you and Spalding that the data on 3 feet versus 6 feet revolves around droplet studies done in the 1930s by William Wells on tuberculosis. And it is crystal clear that 3 feet was good enough for droplets. But in 2003, we found that 3 feet was not good enough for regular old SARS-CoV-1. Therefore, we increased it to 6 feet. Why? Just because. We found that people up to 3 feet were safe from tuberculosis droplets. Unfortunately, they were not safe from aerosolized tuberculosis. Just the droplets, just those coughing droplets. I personally, after watching that, video of the sterilization in China back in February. Can't even imagine. I can't even conceive of why the CDC didn't call it airborne to begin with. It blows my mind. It blows my mind. So unfortunately now the CDC is revisiting 3 feet instead of 6 feet for children in the school. Why? Why is this happening? There are conspiracy theories that are going to abound regarding this, but it is crystal clear that people are using confirmation bias and politically pressuring to open up. That political pressure to open up includes jamming more kids in the school, where we are most vulnerable, especially to B.1.1.7. So how do we get here? Let's really review how we got here. December 31st, 2019, China reported a pneumonia cluster. January 9th, we managed to identify the sequence. It was released out of China. The virus was identified. In the 21st of January, Washington State had their first case up in Kirkland. And then January 23rd, Wuhan went into lockdown. And on that date, January 23rd, 2020, I began to pay attention. Not the first case in Washington, but on the lockdown in Wuhan. And I began to watch the data and it became crystal clear to understand how this all unfolded. But perhaps the turning point for me was when I saw them weld doors of apartment complexes shut. The Chinese authorities welded apartment complexes shut because human beings would not listen to the authorities telling them to stay home. That's right. If you're going to weld an apartment complex shut, you're pretty serious. January 24th, France got their first case in 2020, and January 30th was the first report of asymptomatic spread. That's when everyone really should have paid attention. Asymptomatic spread. I feel fine, but I'm giving everyone novel coronavirus. That's why China welded those doors shut. February 26th of 2020, we saw the first Brazilian case, and unfortunately, Brazil is on fire right now. It's on fire right now. Why? Because they're not treating it as airborne. The Chinese treated this virus as if it was airborne from day one. Why we didn't do that in the United States is beyond me. It's beyond me. Frankly, I think it deals with politics and economy, but we're about to find out how much money we can print to get ourselves out of this mess, which means we could have done that in the beginning as well. March 4th in 2020, the United States had received an article in JAMA that suggested airborne spread. March 17th of 2020, a year ago, we were proving that this virus could be airborne for up to 3 hours. Droplets don't float in the air 3 hours. March of 2020, we knew this was airborne. The 27th of April, we had additional studies in Nature, which showed that it was found in the air of hospitals and found in the air of bathrooms. At coronatestct.com, we had been treating this as airborne from the beginning. Everyone was in N95s. It took until July until epidemiologists from the United States and different organizations led by UPenn had to petition to have the World Health Organization, the CDC, recognize it. Unfortunately, it wasn't until October that the CDC updated their website and said droplets, because we called it droplets, may be airborne. And that most infections are spread through the magical damn 3 feet contact. It wasn't until just this month that an early publication, which is due to be published in June, came out from Australia indicating clear evidence of airborne transmission. Ladies and gentlemen, we took 16 months to prove something that countries such as China knew from the very beginning. It's time to throw political sensibilities out. We need to prepare and protect our future generations. Why did we not accept that it was airborne from the very beginning? Well, it would kill businesses. I mean, think about it. We would kill Broadway. We did. We'd kill restaurants. We did. We'd kill bars and bowling alleys. We did. We did all of those things. But we can't lock down forever. I'm going to tell you myself, great story. We began testing for novel coronavirus at our Greenwich office in our drive-thru. We received a cease and desist letter from our owners of our building in Greenwich at 1 East Putnam Avenue, right? The owners of that building sent us a cease and desist letter. You can't test anymore. Why? Because it'll go away. Wrong. And just because you have money doesn't mean you're smart. If anything, most people with money are not smart. That's my assessment. Most people with money are not smart, especially those running buildings. They may be able to run a building, but what they need to recognize is what restaurateurs are recognizing right now. The ball game has changed. Unfortunately for them, back in March, it didn't change. And they moved to evict us and kick us out of our building because we were testing for novel coronavirus. Why? Because if you don't test, then it'll go away. Well, lots of other people in the building shouted at us. They said, "What are you doing? You're bringing COVID to the building." When in essence, we were testing people outside of the building to prevent them from bringing COVID in the building. But we couldn't tell that because the CDC was saying it's droplet. Wrong. ASHRAE, the gold standard for HVAC that advise governments all over the world, have just said it's airborne. We knew that in the beginning. Unfortunately, businesses were choosing wealth over health. But we can't lock down forever. Restaurateurs are suing governments because operating at 25% is untenable. Take a look at that. Take a look. Read up there. Read over here. Operating at 25% is untenable. The businesses simply cannot survive at that capacity. Being able to fill seats at 25% makes it not even worth opening. Not even worth opening. So 25% capacity isn't worth it. Restaurateurs in New York City are suing New York State. Yet our building managers in our Stamford office are introducing fancy ionizers that'll pump buildings full of ozone. It's crystal clear that building owners, landlords, and business owners don't have the desire or the motivation to believe COVID is airborne because they simply cannot change their paradigm. Today, we're going to go through some solutions for them. Unfortunately, we're moving out of our Greenwich office and we went to go look at another office in Greenwich. But guess what? The owners of the building that we're at are partners in the other building that we're trying to go into. Therefore, Irish need not apply. That's right, they're not going to let us into the building. Why? Because we're the troublemakers trying to keep the building safe and keep our cities and towns safe. The paradigm has not changed. And I think business owners and building owners should bear some liability here. Maybe that'll cause them to wake up. We can't lock down forever. The public is going crazy. Here we have a parent who is upset and says, "I want my hour back. Why are you closing school early? I need those kids in school. It's good for them. It's healthy for them." Well, guess what? Maybe it is healthy for them. But what's not healthy is throwing our kids into schools that are not properly ventilated. You know, we can talk a lot about this. The desire for human beings to socialize is strong. And it's getting even more crystal clear that citizens, they don't have the desire or the motivation to believe COVID is airborne. Take a look in Texas, where open table seated diners are spiking. We open up, so everyone rushes to the restaurant. I don't know what's so great at a restaurant. I don't know what's so great at a bar. But humans need to be in contact with each other. They need a break. Rather than walk outside and enjoy the sun, they want to be in bars and restaurants. Okay, that's fine. Citizens don't understand that it's airborne. We can't lock down forever. But we need to realize COVID is airborne. And it took until this month for the CDC to make some sort of acknowledgement of this. Study in Australia identifies that a church which was video monitored so we can see all who were in attendance. Adhered to the Australian guidelines. Those guidelines are even stronger than United States guidelines. Yet they didn't have the ventilation running in this big church. The doors and the windows were closed. And the attack rate is 2.4%. 2.4%. So who cares? It's fine. It's not going to hurt anyone. Wrong. People went to the ICU. 12 people got sick. I don't understand how guidelines cannot include HVAC with proper MERV 13 to 16 or HEPA filters everywhere. We're going to have a big problem if we don't recognize COVID as airborne. The Society for HVAC Guidelines, known as ASHRAE, founded in 1894, respected internationally. They publish handbooks for environmental engineers. They have been so frustrated with this that they put out a policy statement just the other day. An unequivocal statement on airborne transmission of SARS-CoV-2 in buildings. In buildings. Precisely what I was doing back in March 2020, telling my building owners, Dummkopfs, if you let COVID in your building, it will spread in your building. So keep the COVID out of your building. Keep the COVID out of your building. Test outdoors. They didn't want to hear it. They tried to evict me. Madness. Madness with money, choosing wealth over health. And they don't care about the people in their building. They just care about their rent payments. They just care about their rent payments. And it is so crystal clear that ASHRAE had to make comments now and say the following. Airborne transmission of SARS-CoV-2 is significant and should be controlled. Should be controlled. Changes to building operations, including the operation of heating, ventilating, and air conditioning systems, can reduce exposures. Fix your buildings. Now, who is ASHRAE? These are not just some wild, crazy people out there. ASHRAE's been around since 1894. They've designed green building design standards. They work on smart grid design. They are part of the green movement. They create handbooks for building engineers. And what did they say? COVID is airborne, fix your buildings. So all I have to say about the restaurateurs suing the state government in New York City, fix your buildings. If you want to have full capacity, fix your buildings. It's crystal clear building owners, landlords, and businesses don't have the desire or the motivation to believe COVID is airborne. How can they do it? How can they open safely? How can we open up safely? Well, there's some great tools. Great tools. It requires some work. It requires some work. As just an anecdote for you, I went to the Yankee game the other day. Now, the New York Yankees require either an antigen test within 6 hours, which is great, or a PCR test 72 hours before the game. That's crazy, right? PCR test 72 hours before the game, that's crazy. It should be same day, regardless. Or proof of vaccination. Or proof of vaccination, which is great in a city that doesn't have the Manaus variant or B.1.526, which can escape vaccination. So here's how we do it. We do air quality monitoring. One of the things here you can see is what we call an air quality detector, and we look for something called parts per million. Above 700 and you have to start worrying. Above 1,000, people get headaches and performance is affected. So why wouldn't you want a parts per million at like 700? So I'll tell you this. Put the air quality monitors in the restaurants. Put them in the businesses. Put them in the offices. And when the ppms go up, fix your ventilation. Increase your air cycling, your air cycling time. Improve your ventilation, introduce HEPA filtration. Introduce HEPA filtration. In addition to that, I believe hygrometers are very useful because dry air leads to aerosol-like spread of COVID. So we're going to keep our humidity up. But it's crystal clear in my mind that, listen, we're now in April of 2021, and the building that we just tried to go into blackballed us because we test for COVID. Businesses must be held liable. Businesses have to be held liable for this. Otherwise, they're not going to do it. You either hold them liable through government accountability. Departments of public health need to monitor PPMs for PCO2 here. Or building codes need to be created to protect ventilation. Give N95s to the patrons. An education campaign needs to be undertaken for those indoor businesses who require high capacity, like the restaurants that cannot operate at 25% capacity. So how do we safely open up? We keep ventilation appropriate, but we also screen. DoorDash is working with Vault to do at-home antigen testing. I think at-home antigen testing, at-home PCR testing is a brilliant model. I think it's a brilliant model. Places such as Major League Baseball have done a very bold move, requiring antigen testing, PCR testing, or proof of vaccination. I'm here to tell you right now, in Seattle, vaccination is no guarantee of not being infected. We need to prepare for that as P1 continues to spike. In New York and New Jersey and Michigan, we're seeing spikes of B.1.1.7. So antigen testing 6 hours before is great. Variants can escape vaccinations. We know this now. But usually they can't escape an antigen test. So small businesses are going to have to be held liable. We need to educate them. Indoor events are going to need air purification. Those air purification systems include HEPA filtration. The HEPA filtration needs to be tested. And if you have a central air system, your HVAC system should have a MERV 13 to 16 particulate matter filter to prevent transmission of novel coronavirus, to filter it out. In addition to that, we have all of these ionizing systems, and none of them have been approved by ASHRAE. And they introduce ozone into our air. Ozone's not safe. It's an irritant. It can hurt the lungs. Again, it may be cheaper. And I can tell you right now that one of our buildings, the building owner, introduced one of these ionizing systems because it was cheaper. It was cheaper than retrofitting filters for MERV 13 to 16. So they chose the cheaper route. If businesses are choosing the cheaper route, we either need to find a way to give them grants or subsidies to choose the proper route, or we need to hold them liable. I'm sorry, but that's how we do it. That's how we keep people safe. We can do it that way. We just have to have a will. We need a model to open. How do we have a model that's opening, right? Where do we lay it out? Because it's crystal clear right now that the CDC is not going to help. The heating and air conditioning engineers had to demand it. Local epidemiologists had to demand it. COVID is airborne. Connecticut may have a model. That's right. We're going to open sectors in Connecticut over time. We're going to open sectors. First and foremost, we have to have a contact tracing system in place and adequate testing capacity. Adequate testing capacity. The DoorDash, the at-home testing, the antigen testing, I think it's all a move in the right direction. The PCR testing, a move in the right direction. But HEPA filtration, HVAC systems, they need to be there. They need to be there. Restaurants need to have outdoor dining, especially as we enter the spring and summer seasons. We need to watch capacity. We need to properly monitor air filtration. COVID's airborne. We knew that in March of 2020. Why we aren't admitting that it's airborne is purely because of political sensibilities. Our cognitive biases are killing us. We need to admit it. We need to admit it. If businesses cannot operate with airborne transmission in mind, then they can't operate safely and they shouldn't open. Safety is the first key. If you'll look back here, safety is the first key. Safety first. Without the tools to be safe, including PPE, air quality monitors, hygrometers, HEPA filters, and MERV 13 to 16 filters, we're going to continue to have waves. We're going to continue to have waves. You saw what they did in China. We still haven't done anything like that. We haven't done anything like that. You need to ask why. You need to ask why. It's not about civil liberties here. It's about the safety of our future. Our children, schools, bars, restaurants. Society as a whole needs to change the mindset. We're not going to get rid of this magically with vaccination. It's not going to happen. It's not going to happen. I can tell you right now. Why? Well, let's go through the Canada update. British Columbia, BC is having a P1 epidemic. The CDC is advising against travel to Canada, but more importantly, they issued a very high level of COVID update, which includes the vaccinated, which the CDC said you could travel but probably shouldn't, are vulnerable. I will read right here. Because of the current situation in Canada, even vaccinated travelers may be at risk for getting and spreading COVID-19 variants and should avoid all travel to Canada. Canada's in for a challenge, just like Brazil was. We're foolish to not think that this is going to be in Seattle soon. Major League Baseball, tune in. Here's the deal. The Mariners are going to get this P1 variant. If Major League Baseball is not properly testing, I believe the PCR testing model should probably be removed to same-day PCR testing for Major League Baseball. And I also believe that the antigen testing plus vaccination is the key to prevent COVID spread. Restaurants, bars, antigen testing plus vaccination plus HEPA filtration. Why can't we do this? You can go to Bed Bath & Beyond and buy a HEPA filter for $30. Don't tell me it's the cost. It's the lack of education and it's the lack of governmental enforcement. You know what's awesome about this update? And first off, just in addition to that, we have a statement from the team physician for the Canucks, which clarifies precisely what's going on here. The Vancouver Canucks that have been infected with novel coronavirus have been infected with the variant. It has been proven that the variant has caused this outbreak for the Vancouver Canucks, and I guarantee the Whistler outbreak was also a P1 variant. Our government's not ready to handle this. Society is not ready to handle this. As evidenced by the magical 6 feet still included in today's CDC update. 6 feet is not going to protect you from novel coronavirus P.1 Brazilian variant, and vaccines aren't going to protect you either. COVID is airborne. We can't deny it. The evidence is mounting, and it was mounting back in March of last year. To the building owners who will not lease to me because we're testing for COVID, history will prove you wrong yet again. But you probably don't care, because all you care about is the rent. Rent seeking versus public health. Get ready to revamp all of your buildings. There's no doubt in my mind that Governor Lamont is totally going to revamp this. And if he's not, he's just kicking the can down the road for a wave after a wave after a wave. And that's my take. So to wrap up briefly, March of 2020, we knew that this was an airborne disease. March of 2020. We did not have the political will to treat it as an airborne disease. Sure, we shut down the restaurants, but now as the political demand to open up, to start our businesses again, to improve our economy again, push forward, we need to be honest with our fellow citizens. Like my mug. We have to be honest with our fellow citizens. Fellow citizens of the United States. The Manaus variant is in Vancouver. It's airborne. And it escapes vaccination. There, I said it. The B.1.127 variant does not escape vaccination, but the Manaus variant spreads more. And it's just at our northern border. It's going to spread here too. B.1.127 in the greater New York City area is being replaced with B.1.526, which also has the E484K mutation in the receptor binding domain. The Californian variants have receptor binding domain mutations. The Indian variant has receptor binding domain mutations. P1, receptor binding domain mutations. P1 escapes vaccination. We will find that. The CDC knows it, and that's why they had to put the disclosure there on the Canadian travel. COVID is airborne. We need to start treating our indoor air like it's our water. Where is the green movement for healthy ventilation in buildings? If we don't work on that, we're doomed to continue to spread COVID over and over again in multiple waves. That's just the truth. I feel bad for all the tenants of the guys who own 1 East Putnam Avenue in Greenwich and who own 1455 East Putnam Avenue in Old Greenwich, because your landlords don't really care about your health. They just want your rent check. Unfortunately, that is all too true in society today. Many building owners don't have the wherewithal to admit to the one simple fact. COVID's airborne. Protect your tenants. I'm here to protect all of you. It's Dr. Murphy, Murphy Medical Associates, and our team at CoronaTestCT.com. Murphy's Medical Minute is here for you, to protect you. Remember, get sun, get outside, exercise, treat your body right. Your body is made to be well. Lots of people out there want to hurt your body by giving you crappy food and cigarettes and drugs and entertainment indoors that is going to give you an infection because they just want your money. Your health is more important than that other guy's wealth. Treat it that way. We are made to be well. Take care of yourselves. Take care of each other. This is Dr. Murphy, Murphy Medical Associates, signing off. Today is April 7th, 2021. You just watched Murphy's Medical Minute. With